Now this is an ultrasound of a 35 years old male patient, and this is the lumbar region, and what we are seeing is, and this is the aorta, is above the aorta, and heterogeneous with cystic as well as solid elements and minute tiny echogenic particles within it, a solid heterogeneous mass that is seen. Here is the spleen, and if you see that the spleen is normal, this is the hemidiaphragm left, spleen measures 10.4, its echogenicity is normal, no pleural effusion, and this is the solid mass with internal islands of echogenic material scattered throughout, and it is a very well demarcated mass. Here you see there are multiple tiny calcifications. Now it gives a reniform appearance, doesn't it? And below we do see coming down, it gives a reniform shape appearance, and this is the iliopsoas muscle. This one. This strip of muscle is the iliopsoas muscle on the left side, and this is the mass, and this is the spleen. So spleen, mass, reniform shaped mass, the iliopsoas muscle, and note that it has a very well demarcated, it is very well demarcated. See the wall, its lateral side wall, this wall, and the wall is thick, measures about 5 millimeter, and this mass is seen in the region of the left lumbar region, and then it extends downwards as well as it extends downwards and medially. This is the transverse section of the mass, and it extends towards the midline, or you can say I am seeing it now below the left costal margin in the left upper abdominal quadrant. This is a calcification giving posterior shadow. So this is the mass or kidney. Now when I move the probe towards the midline, first let's see where is the right kidney. Now you see this is the right kidney, and the right kidney is absolutely normal. There is being perfused normally, so nothing wrong with the liver or gallbladder, portal vein. IVC is patent. Here you see patent IVC, and now when I come to the midline from the epigastric region, this is the epigastric region. Now when I place the probe in the epigastric region, I can see the livers, excuse me. This is the liver angle, outer surface of the liver, left lobe of the liver, and here when I give a sweep to the probe towards the right side, I see the liver, right side of the liver as well, along with the IVC, and this is the right lobe. Now this is the middle, this is the choroid lobe, this is the ligamentum venosus. So outer surface of the liver angle, the liver angle is sharp, outer surface is smooth. So I am seeing it here, and when I move the probe, and now place the probe longitudinally in the epigastric region and give it just move it or rotate it towards the left side. Here I see the kidney. Now this is the left kidney, which is being displaced by a large mass, and it is being perfused. This kidney is normal. It is being perfused normally, and here, if you will see, this is the aorta in the midline. This is the aorta, this area in the midline. In transverse section, you are seeing it, and sans root rabbit. If we see the left renal artery at the region of the Austrian villosa, the waveform pattern is normal, and now the resistive index is 0.68, pulsatile index is 1.93, slightly raised from the normal, but not raised too much. Coming towards the study again. Now you see, this is the mass that extends from the lumbar region medially and inferiorly. This is the mass, and this is the kidney, and here is the aorta. You see, this is the aorta. You can note the pulsations. This is the aorta. This is the kidney, and when I move the probe a bit towards the left shoulder of the patient, I get the mass. Now this mass shows mild vascularity. It's not highly vascular, but vascularity is seen. थोड़ा बेटा कर बेटा, बस बस बस. Here is spleen and the mass. So this is not the kidney or a renal mass. You see, there is blood flow within the here. Now as I move it downwards towards its lateral margin, this is the lateral margin and middle portion. This is the transverse section. Is vascular. And this is the medial part of the medial margin of this solid echogenic heterogeneous mass extending from the left lumbar region medially and inferiorly, and displaces the kidney. This is the kidney. This is the kidney that we are seeing anterior to this mass, and this is the mass. Left large retroperitoneal heterogeneous mass displacing the kidney left kidney medially, and when the left kidney is otherwise normal, is being perfused normally. सारो क्या जी? बेटा 10 सेकंड ओके सांस ले लो So here you can see now I am showing you both the left kidney with the mass. Trying to get the transverse section of the left kidney. सर रोकना बेटा I'm sorry, it takes time. सर रोक ले बेटा Now here the renal artery, where now the resistive index is 0.56, pulsatile index is 0.91. Now here it is normal. The waveform is normal. The pulsatile index and the resistive indexes are normal. So anyways, the kidney is doing good. Only thing is that it has been displaced. And see, it's close to the aorta. How close it is to the aorta. And here is the mass. So large mass that extends from the left lumbar region then extends medially and posteriorly to displace the kidney, and then it ends over this portion in the right upper abdominal quadrant, but does not cross the midline. And it does not relate to the kidney, does not relate to the spleen or any vessels. So most probably this is some, I don't know, it's very difficult to say, but a retroperitoneal mass with this here we will see the left iliac vessels. No adenopathy is seen, regional adenopathy, nor we see any para-aortic plan adenopathy. So these are the left iliac vessels which are doing good, fine. So the mass does not cross the midline. However, here we see this is the kidney. So this is otherwise the urinary bladder and prostate, testes are normal. So this is our case of the day. Thank you very much.